Hey there, viewers! When was the last time you had a good look at your feet? Many of us have the habit of caging our feet in our shoes all day and not paying attention to them. They could be giving off signs that your health is bad. In today's video, let's see how your feet can be used as the ultimate diagnostic tool for your health. What does foot numbness indicate? What about those black lines under your toenails? Let's discuss it all. Number 1. Dry, flaky skin. Nobody likes having dry, cracked heels. It can stop you from wearing fancy shoes or cause your socks to get caught up in the cracks while pulling them on. Dry feet can be the result of cold weather, dehydration, frequent use of harsh soaps, or even swimming in chlorinated pools. The dryness generally improves after you make changes in your lifestyle. This includes drinking lots of water, using mild soap, and putting on moisturizer. If it doesn't, you're in for some serious health problems. Have you ever had dry skin on your feet? What did you do to get rid of it? Sound off in the comments below and start a conversation with our Bestie community. Flaky skin on the ball or heel of your foot can be a warning sign of a thyroid condition. When the thyroid gland fails to produce enough thyroid hormone, it's called hypothyroidism. This can make your feet feel very itchy and rough. Calluses may also develop. The butterfly-shaped gland in your neck called the thyroid controls your metabolic rate, blood pressure, tissue growth, and the nervous system. In serious situations, painless lumps and patches of scaly skin become hard and waxy. Generally, thyroid disease can go unexamined for years. With a regular foot exam, you can spot thyroid disease much earlier and begin treatment to prevent complications. Also, watch out for some key signs like weight gain, numbness of the hands, and vision problems. Go and talk to a doctor once you see these symptoms. Number 2. Losing hair on your toes. Let's face it, all adults have hair on their feet. Have you ever seen a man's foot? Some of them look like they're part bare. While foot hair may be more visible in men, women do have hair on their toes. It's usually just much finer. A few people will see alopecia and hair loss on their feet and legs, but as long as there are no other serious symptoms, you shouldn't worry too much about it. If you suddenly notice the fuzz disappear from around your toes, it could indicate poor blood flow. Diabetes-related symptoms can creep in very slowly. A condition called peripheral artery disease, or PAD for short, can be caught early if you're super careful. PAD gets in the way of blood flow in your feet. This happens when fatty deposits called plaque build up in the blood vessels. Over time, you'll start noticing that your feet have a lot less hair. If this serious condition is left untreated, you could be at risk of heart disease or stroke. Who knows, your foot could also be amputated. The great news is that PAD is reversible with the right medical guidance. Your doctor will probably tell you to quit smoking, exercise regularly, and eat a more balanced diet. It's also very important that you get your hypertension and diabetes in check. This way, your lost hair will grow back in 6 months. Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all our great Bestie content. Number 3. Foot numbness. We've all experienced numbness in our feet. All you need to do is fall asleep in an uncomfortable position or sit with your legs crossed for too long. Sometimes it goes away in a matter of seconds. Sometimes it takes a lot longer. If it happens frequently and lasts extended periods each time, you might want to look into it. Foot discomfort comes in a few forms. It may feel like a painful, prickly sensation similar to that of pins and needles. There are just so many nerve endings in your foot that help you deal with hot surfaces and rough terrain. But with numbness, your sense of touch and balance can be altered. If this phenomenon keeps repeating while you're awake and active, it's definitely something you don't want to ignore. Just like your feet losing hair, foot numbness is also a sign of PAD. It results from a chronic condition, usually type 2 diabetes. If there's a blockage, infection, or compression of the nerves that carry sensations from the tips of your toes to the brain and back, you'll experience severe numbness. Diabetes can also complicate wound healing on your feet, leaving open wounds that will eventually become infected. If you're seeing things like this, you need to talk to your doctor ASAP. Having healthy, wholesome foods and working out regularly can pull you out of this situation. Problems with walking can be linked to low vitamin B12. Before we move ahead, here are 15 signs you have vitamin B12 deficiency. Now back to our discussion on 5 things your feet are telling you about your health. Number 4. Black spots under your toenails. This one is pretty scary. It's especially creepy how they just appear out of nowhere. Dropping a heavy object on your toe can bring on unbearable pain. Even after the pain leaves, there may be black discoloration left to remind you of the injury. But today we're not discussing that. That bruising will eventually go away. If you notice black or brown spots under the toenails, this is when you should worry. It's possible to develop dark lines and spots under the nails of your toes. If it happens without any prior injury, you need to schedule an appointment with your doctor right away. Dermatologists believe such black spots could be an early warning sign of skin cancer, with the dark vertical lines indicating melanoma. As time goes by, these spots can change in size, shape, and even color. Another possibility for spots can be fungus. Sometimes nail fungus gets trapped, which can give your nail a yellow, brown, or green appearance at the corners. Your doctor may prescribe you some antifungal drugs to prevent it from spreading to other toenails. You don't need to check your toenails every moment of every day. Just have a look at them every now and then. This is how you catch early signs of potential disease. The sooner you detect something, the sooner your doctor can lay out a course of action. Number 5. Morning foot pain. Imagine you go to bed feeling fine. You wake up the next morning and put your foot down to stand up. The second you rise out of your bed, you immediately feel a sharp, burning pain in your foot, which stays with you as you walk. There could be several potential causes for this. Your foot is made up of 26 bones, 30 joints, and roughly 100 muscles, tendons, and ligaments. All of them work in unison to provide you with support, balance, and mobility. Arthritis is a condition where most of the joints are inflamed and in a continuous state of pain. You can get rid of arthritis symptoms with regular medication and proper exercise. Just remember to talk to your doctor beforehand. You don't want to make an uninformed decision that will only worsen your health problems. Another condition that early morning foot pain could be pointing towards is plantar fasciitis. The plantar fascia is a thick band of tissue that connects your heel to your toes. It's generally in a contracted state during sleep. Underlying inflammation and tissue stretching while walking will make you feel a sudden sharp pain on the bed of your foot. Plantar fasciitis requires regular stretching and exercise for just a couple of minutes. This happens before you get out of bed and on with your daily routine. Another reason for morning foot pain could be a plain muscle cramp. Cramps are generally a sign of dehydration. This is how your body tries to tell you it needs nutrients and you need to change your diet ASAP. Muscle cramps are generally due to a deficiency of calcium, potassium, and magnesium. There are a few known foods that are rich in these elements. Having them before going to bed can alleviate your pain symptoms magically. Nutrient deficiencies happen when you least expect it. You don't even know you have one until your doctor tells you. Have I sparked your interest? Let's keep the conversation going with a couple more videos, shall we? Here are 7 signs you have a magnesium deficiency. You can also check out 8 signs you have a potassium deficiency. Go ahead, click one, or better yet, watch both and learn more about nutrient deficiencies. Have you had any of these foot conditions? What did you do about it? Let us know in the comments below.